episode. Today's topic, we're talking about the dry skin. So I'm going to cover with you how to take care of dry skin. Now, the first thing to find out, you need to find out if you have dry skin or not. The best way to do it is, as I always say, you need to go to your dermatologist or to your certified beautician. Usually these are the best people to tell you what your skin type is after examining you. If you look at your skin closely, you usually find that the pores are extremely small and closed. They're not wide and they're not wide like the oily skin type people. And dry skin people are usually, they'll find that they're dry, flaky, they have dull skin, and they are prone to sensitivity and prone to early wrinkles. So how are you going to take care of your dry skin? Let's go through that. Usually you need to choose your products very carefully. Most of the products that you're going to use has a moisturizer, from your cleansers down to your day cream and your night cream. But how to choose it? So the first thing you need to do is choose your cleanser. If you're choosing the cleanser, always, the dry skin people, always read the labels first, that it has to be for dry to a very dry skin. And usually it's either a lotion or a milk cleanser. Stay away from gels and stay away from foams. Now, even if you're choosing a toner, the toner usually also has some sort of moisturizing effect. So it's usually going to be white in color. Now, rarely I tell my patient to use day creams and night cream, but when it comes to dry skin type people, I actually do emphasize on them that they need to use their day cream and they need to use their night cream. Dry skin people don't have their own moisture, so they need to compensate for it by using an external moisturizer. And they'll need to use it throughout their life. Because that's the only way they're going to moisturize their skin. The serums in the morning, I like them to use serums, but what I like them to choose is the new upcomers, which are the hyaluronic acid. So the hyaluronic acid is actually the original substance that we have inside our skin that gives us that plump and softness. So it's nice that now we have it in serums. So it kind of plumps the skin when you apply it, reduces the wrinkles with time, gives you an internal moisturizing, and also forms a barrier to help protect the skin from the environment. And then on top of it, if you need extra moisturizing, then you would use the day cream. Don't forget, dry skin people really need to be adamant about using their sunscreen. The sun damages the collagen in the skin and causes premature wrinkling. So it's important for them, because dry skin are already prone for wrinkles, that they need to use their sunscreens regularly. Now, when it comes to night care, this is the time where I like to add something like an anti-aging serum. Something that has hyaluronic acid, plant stem cells, and retinols. And then they can apply their night cream. Now, I'm going to stop here just for a second and talk about the retinols. The retinol itself, to some people, will cause flakiness and sensitivity. So with dry skin people, it becomes kind of worse. There has to be a balance. In the beginning, I like them to use the retinol serum 3 times a week for almost a month. The skin gets used to it, and they compensate for the dryness with using regularly their day and night moisturizers. Once the skin becomes used to the retinols, they can start using it at night, every night, as tolerated. Now, the thing about retinols, why I like it in dry skin people, it's because they're prone to early wrinkling, and this helps them combat early wrinkling. Because retinol is an anti-aging ingredient. Now, this is for their day care and night care. Now we're going to talk about things that they need to avoid. Now, I want them, usually dry skin people need to avoid anything that's irritant and anything that's abrasive. So like perfumes and skincare products, or alcohol and skincare products, or things like salicylic acid and overly scrubbing cleansers. Okay? Because the dry skin people have already sensitive skin, and this makes them more sensitive. Now, again, we have to talk about the balance. Sometimes we do use products with alpha hydroxy acid for dry skin people because they have a compact of dead cells on top of their skin. and this sometimes they need to smoothen out the skin by removing it. This has to be done very carefully. So when you're doing the alpha hydroxy acid, usually it's inside a cream form, and they apply it, causes a little bit of dryness. Either they're going to use it once or twice a week, according to the tolerance, or they can use it for a whole week, and then they have their peeling, and then after that they stop. So they can only do it like once a week, 1 week per month. But they cannot go on for it for on and on and on, because that's going to cause them to be sensitive with time. So they really have to be careful when they're using products with alpha hydroxy acid. Okay, so this is for the day care. Now, weekly care, they can always use the brushes. Now, this is something, different opinions. For dry skin people, if they're using the brush, they need to find the brush that is for dry and sensitive skin, because usually it's softer. I don't like my patients to use their brushes every single day, because it might become, their skin becomes sensitive with time. Even if they say it's very gentle. I prefer only if they want to do a deep cleanse, to do it once or maximum twice a week, and they can use the brush at that time. But the cleanser and the toner, it has to be something specific for dry skin people, and they have to choose mask that is more hydrating and more moisturizing for the skin. So that would be their weekly care. Now, in the clinic, there are things as a doctor I can provide for them in order for them to help them to have moisturized skin. There's a lot of facials that are specific for dry skin people and anti-aging and for sensitive skin. So they can do that once a month. I don't like it to be every week, because that also causes them to be too sensitive with time, unless we place them on a specific course. A course of treatment plans, so that's a different thing. The other thing that we can do is that do mesotherapy injections. The mesotherapy injections, if it's suitable for their condition, we can always do hyaluronic acid injections, and these injections actually do internal moisturizing. Now there's a new, I'm a big fan of the PRP, which is the plasma injections for skin rejuvenation. And now there's a new group where it's actually containing hyaluronic acid. So it's a mixture of the plasma and the hyaluronic acid, which we can inject into the skin, and that also gives them hydration. There's also the hydrofacial, one of my favorite treatments, which is also suitable for dry skin and sensitive skin people, because it directly infuses the serums into the skin after doing a deep cleansing with all the stages of hydrofacial. Okay, with this, YouTubers, I came to the end of the episode. I hope you benefited from it. Please leave your comments in the comment box below, and don't forget to subscribe and like, and I'll see you next week.